Nursing Assistant Study Series, Group 2. Therapeutic Communication and Active Listening. Welcome to Group 2 of the Easy Life Studio Nursing Assistant Study Series. In Group 1, we studied the nursing assistant's role, professionalism, verbal and nonverbal communication, communication barriers, the healthcare team, activities of daily living, care plans, and reporting important observations. In this lesson, we will continue with therapeutic communication, active listening, professional touch, communication techniques, resident autonomy, and communication methods that nursing assistants should avoid. If you are preparing for your CNA class or competency exam, please subscribe to Easy Life Studio and continue studying with us throughout this nursing assistant study series. Let's begin. Therapeutic communication. Therapeutic communication is professional communication used to promote understanding and participation in care. Nursing assistants use therapeutic communication when interacting with residents. Therapeutic communication helps establish trust and allows residents to communicate their feelings, concerns, needs, and preferences. When communicating therapeutically, nursing assistants should listen without judgment. They should respect professional boundaries. They should recognize communication barriers. They should respect cultural beliefs and individual differences. They should also make sure the resident understands what is being communicated. Communication should always support the resident's dignity and well-being. Active listening. Active listening is an important part of therapeutic communication. Active listening means giving the resident your attention and showing verbally and non-verbally that you are interested in what the person is saying. Active listening is different from passive listening. Passive listening occurs when a person does not fully engage with the speaker or assumes they understand the message without verifying it. Competitive listening occurs when a person is more focused on expressing their own viewpoint than listening to the other person. During active listening, the nursing assistant listens carefully and verifies understanding. One useful technique is restating what the resident said. For example, a resident may say that they do not want to attend physical therapy because they are afraid of falling. The nursing assistant might respond, "I hear you saying that you are afraid to go to physical therapy because you are worried about falling. Is that correct?" This gives the resident an opportunity to confirm the nursing assistant's understanding or correct any misunderstanding. Attending behaviors. Attending behaviors show the resident that you are paying attention. These behaviors may include appropriate eye contact, attentive posture, facial expressions, nodding, and verbal responses. Avoid appearing distracted when a resident is discussing an important concern. Whenever possible, give the resident your appropriate attention. Pay attention not only to the resident's words but also to their facial expressions, body movements, tone of voice, and behavior. Sometimes a resident's nonverbal behavior communicates information that the resident has difficulty expressing with words. Professional touch. Touch can communicate caring and compassion when used professionally and respectfully. Nursing assistants commonly use touch while providing personal care and assisting residents with activities of daily living. Professional touch may also provide comfort. However, every resident is different. Personal and cultural preferences concerning touch should always be respected. Do not assume that every resident is comfortable being touched beyond what is necessary for care. Observe the resident's response and respect personal boundaries. Active listening techniques. Several techniques can help nursing assistants communicate therapeutically. The first is active listening. Use verbal and nonverbal behaviors to show that you are listening. Simple responses such as "I see" can encourage the resident to continue speaking. Another technique is silence. Silence does not always mean that communication has stopped. Deliberate silence can give a resident time to think, process emotions, and decide what they want to say. Do not feel that every moment of silence must immediately be filled with conversation. Providing acceptance. Providing acceptance means acknowledging that the resident has been heard. Acceptance does not necessarily mean that you agree with everything the resident says. For example, a nursing assistant might say, "I hear what you are saying." This response allows the resident to know that the nursing assistant is listening without passing judgment. Giving recognition. Giving recognition means acknowledging a resident's behavior or progress. For example, a nursing assistant might say, "I noticed that you ate all of your breakfast today." This recognizes what the resident accomplished without making an unnecessary judgment. Offering self. Offering self means being willing to spend appropriate time with a resident. Residents may experience loneliness, fear, anxiety, stress, or sadness. Sometimes simply being present and listening can communicate caring. Nursing assistants should remain professional while showing compassion and support. Open-ended questions. Open-ended questions encourage residents to express their thoughts and feelings. Examples include, "What's on your mind today? What would you like to talk about? How are you feeling about that?" These questions allow residents to provide more information than a simple yes or no response. However, open-ended questions may not be appropriate for every resident. A resident with cognitive impairment may become confused or overwhelmed by broad questions. In that situation, simple choices may be more effective. Always adapt communication to the individual resident. Seeking clarification. If you do not understand what a resident is saying, seek clarification. You might say, "I'm not sure I understand. Can you explain that to me?" Clarification helps prevent misunderstandings. Never pretend that you understand something when you do not. It is safer and more respectful to ask the resident to clarify the message. Placing events in sequence. Understanding the order in which events occurred may help clarify important information. For example, if a resident reports dizziness, the nursing assistant might ask, "What happened before you started feeling dizzy?" Or, "What happened after you stood up?" The nursing assistant should listen carefully and report relevant observations to the nurse. Do not attempt to diagnose the cause of the resident's symptoms. Observe and report. Easy Life Studio Study Reminder. You are about halfway through Group 2. If these CNA lessons are helping you understand and remember your nursing assistant material, please subscribe to Easy Life Studio and continue studying with us through the complete series. Now let's continue. Making observations. Making an observation can encourage a resident to discuss a concern. For example, a nursing assistant may say, "I noticed you haven't eaten much today." This may encourage the resident to explain whether they are experiencing nausea, pain, difficulty swallowing, loss of appetite, or another problem. The nursing assistant should report important changes or concerns to the nurse. Enjuraging description. A resident may describe something that the nursing assistant does not personally perceive. The nursing assistant should remain calm and communicate without judgment. Allow the resident to describe what they are experiencing. Do not ridicule the resident. Do not respond in a way that humiliates or embarrasses the person. Listen carefully and report significant observations according to the resident's care plan and facility procedures. Encouraging comparison. A resident may have experienced a similar challenge in the past. The nursing assistant can encourage the resident to think about what previously helped. For example, "Have you experienced something like this before?" Or, "What helped you the last time?" This can encourage residents to identify coping strategies that have previously worked for them. Summarizing. Summarizing demonstrates that you have been listening. It also gives the resident an opportunity to verify information. After listening, the nursing assistant may summarize the important information and ask, "Does that sound correct?" The resident can then confirm the information or correct a misunderstanding. Reflecting. Residents sometimes ask healthcare workers what they should do about personal decisions. Instead of immediately giving personal advice, therapeutic communication can help residents consider their own thoughts, feelings, and choices. This supports resident autonomy. Autonomy means recognizing a person's right to participate in decisions concerning themselves and their care. Focusing. During a conversation, a resident may mention something that appears particularly important. The nursing assistant can focus on that statement and encourage the resident to explain further. For example, "You mentioned that you have been afraid at night. Can you tell me more about that?" The resident's response may reveal an important concern. Significant concerns should be reported appropriately. Empathy. Empathy is an important part of therapeutic communication. Empathy involves attempting to understand another person's feelings and perspective. Nursing assistants should communicate honestly, respectfully, and genuinely. Residents should feel that their concerns are being heard and taken seriously. Empathy does not mean that the nursing assistant has experienced exactly the same situation. It means attempting to understand how the situation may feel from the resident's perspective. Non-therapeutic communication. Nursing assistants should recognize communication behaviors that can interfere with a therapeutic relationship. One example is asking unnecessary personal questions. Do not ask questions unrelated to resident care simply to satisfy personal curiosity. Maintain professional boundaries. Another non-therapeutic behavior is giving personal opinions or personal advice. Residents should be supported in making their own decisions rather than being told what the nursing assistant personally believes they should do. For example, avoid statements such as, "If I were you, I would do this." Instead, encourage residents to discuss their concerns and communicate with the appropriate healthcare professional when necessary. Arguing. Arguing with a resident is generally not therapeutic. An argument can make a resident feel defensive or unheard. Listen respectfully. If a resident has a concern that you cannot resolve within your role, report the concern to the appropriate nurse. Never respond to anger with unnecessary anger or aggression. False reassurance. Avoid giving reassurance that you cannot guarantee. Statements such as, "Everything will be fine," may sound comforting, but the nursing assistant may not know whether everything will actually be fine. A more therapeutic approach is to acknowledge the resident's concern and listen. For example, "I can see that you are worried. Would you like to talk about what is concerning you?" Changing the subject. Avoid abruptly changing the subject when a resident is expressing an important concern. Changing the subject may communicate that you do not want to listen. Allow the resident to express the concern when appropriate. If the concern involves a change in condition, safety issue, pain, abuse, or another important problem, report it according to facility procedures. Resident autonomy. Resident autonomy is an important principle of person-centered care. Residents should be encouraged to participate in decisions about their care. Nursing assistants help residents complete activities of daily living and work toward goals identified in the care plan. Care should consider each resident's needs, values, abilities, and preferences. Avoid making assumptions based on a resident's age, diagnosis, disability, appearance, culture, or background. Maintain a respectful and non-judgmental attitude. Listen to the resident. Do not unnecessarily interrupt. Encourage residents to do as much for themselves as safely possible according to their care plan. Respect and dignity. Every interaction should protect resident dignity. Knock before entering when appropriate. Introduce yourself. Explain the care you are going to provide. Provide privacy. Use the resident's preferred name. Listen to resident preferences. Do not speak about a resident as though the person is not present. Do not ridicule, embarrass, or unnecessarily criticize residents. Do not treat an adult resident like a child. Include residents in conversations about their care whenever possible. Professional boundaries. A professional caregiving relationship is different from a personal friendship. Nursing assistants should be friendly, compassionate, and respectful while maintaining appropriate professional boundaries. Do not make the relationship about your own personal problems. Do not use residents to satisfy your emotional, financial, or social needs. Do not take advantage of a resident's vulnerability. Follow facility policies concerning gifts, money, personal contact, social media, and relationships with residents. Group 2 Review. Remember these important points. Therapeutic communication promotes understanding and participation in care. Practice active listening. Pay attention to verbal and nonverbal messages. Use appropriate attending behaviors. Respect personal and cultural preferences regarding touch. Silence can give a resident time to think and process emotions. Acceptance shows that you have heard the resident without necessarily agreeing. Recognition acknowledges resident behavior or progress. Open-ended questions encourage residents to express their thoughts. Seek clarification when you do not understand. Use observations to encourage residents to communicate concerns. Summarize information to verify understanding. Support resident autonomy. Use empathy. Avoid unnecessary personal questions. Avoid giving personal advice. Avoid arguing. Avoid false reassurance. Do not abruptly change the subject when a resident is expressing an important concern. Protect resident dignity. Maintain professional boundaries. Observe important changes and report them appropriately. You have completed Group 2 of the Easy Life Studio Nursing Assistant Study Series. Please subscribe to Easy Life Studio so you don't miss Group 3, where we will continue with professional communication, resident and family interactions, confidentiality, reporting, documentation, and other important CNA concepts. Thank you for studying with Easy Life Studio.